Good morning, everyone, and thanks for logging in today. I would like to introduce Prameya Health to start with. Am I audible?
Yes, Kripa, you're audible.
Prameya Health is a preventive and a supportive care organization and is actively involved in providing supportive care to cancer survivors by bringing them back to new normal and also on trying to work on the improvement of the quality of life. And we do this through FENS dimensions, which is fitness and emotional, nutritional, and also spiritual well being. Reboot Your Life is our flagship program under Sahai FENS programs. Today, in this program, which is a part of our 12 sessions, we have carefully put together a session on how to manage lymphedema, which is a significant side effect of breast surgery. In today's program, there will be experts from various areas like surgical oncology, physiotherapy, and yoga therapy for lymphedema management. We hope this program will be useful for all of you, and it gives me immense pleasure to introduce the first speaker of today, Dr. Sandhya Ravi, breast surgeon and director, Sahai FENS programs and Prameya Health. She'll introduce the fundamentals of lymphedema, and the other two speakers will follow her. Thank you so much, ma'am. Over to you. You are on mute.
Yeah. Thank you, Kripa. Good morning and welcome to all of you. For the people who are already with us in the Sahai program, just to let you know that we have some new people who have joined us who have been interested in participating in the lymphedema care program. So as Kripa introduced, I am Dr. Sandhya Ravi. I'm a surgeon with about 36 years of experience in handling breast cancer and benign breast diseases. So over the years, we've seen a lot of patients who have been treated with surgery, radiation therapy, and so on for breast cancer who have developed lymphedema. Some have not developed lymphedema despite very extensive surgery and radiation. So how does this happen? So this is always a very interesting question in the minds of oncologists, how some people are more prone to it, some people absolutely free from it. And is there something that we can do to prevent it? Is there something that we can do to control it and so on? There's a lot of literature there, a lot of studies being done, but there are still some questions which are unanswered. So in order to understand what is lymphedema and how we can prevent it, how we can manage it once it happens, we planned this session today. And we have a lot of patients who have been with us, who have lymphedema, who are going through treatment and so on, who will also be able to share their experiences when there are question and answers. So the way we've designed the program today is I'm going to talk to you a little bit about what lymphedema is, because first you must understand the problem, right? You must have a very clear understanding of why it happens and who is more prone to it. And then, we have Dr. Sneha, our physiotherapist, who will go through certain exercises and the massage techniques. And then we have Swati, who's our yoga therapist, who will teach you some things, some postures and some asanas which are as effective as compression and massage that we recommend for lymphedema. Yeah, come on. So let's start off. So first, to understand what is lymphedema. So first of all, we need to know what is lymphatic system. Okay. So I would suggest that all of you stay on mute for a while, and in case you have any questions, please type it in the chat box so we can address it. And of course, at the end of the session, we can have an interactive, we can have some interaction. So all of us know the circulatory system. All of us know what is, the artery, what is the veins, what is good blood, what is bad blood. But what is a lymphatic system? So as you can see on the picture on your left, on the left of the screen, the lymphatic system is there. It's scattered throughout our body in different parts of the body. Starts from our mouth. All of us know when we have some ice cream or something cold, or if we are exposed to a lot of dust, we immediately get some throat irritation. We may get swelling in our neck. Our tonsils may become swollen. All those are lymphoid tissues. Sometimes when we have some chronic infection, maybe children have lice in their head, or you have a lot of dandruff, you can have a few nodes in your neck. So you have lymph nodes in your neck. And these are all, what shall I say, like warehouses or go-downs of lymphatic tissue. Then you have some lymph in the middle of your chest, which is just below your throat, which is called the thymus. In fact, that is the first lymphatic tissue which develops in a newborn. And then you have lymphatics under your arm, the lymph nodes under your armpits. You have lymph nodes in your groin, in both your, the root of both your thighs. Then big lymphoid organs like the spleen, and also you have some lymphatic tissue in all your bones, the central part of your bones, which is called the bone marrow. So throughout the body, you have lymphatics, lymph nodes, lymphatic vessels. Now these small vessels, when I say vessel, it's not like a patre or a container, but it is a very, very narrow, fine tube. So when you look at your hand, each of you look at your hand, you can see bluish lines, right? In Kannada, or even in Indian language, we call it naragalu, nerves, but it's not nerves. These are veins. What we see, the blue ones prominently, are veins. And sometimes when you put your hand in your neck, when you keep your fingers like that, or you feel your wrist, you can feel the pumping of the heart in the blood vessels. Those are the arteries. Wherever you feel the pump, it's the artery. You can feel it in your elbow, you can feel it in your neck, you can feel it in your thigh and your foot. Those are the arteries. But what about these lymphatics? Nobody can see it. Even when we operate, when we cut open the body, we cannot see the lymphatics. They're very, very fine. Finer than a strand of hair. So it's a very small network all over the body, just beneath the skin, and they all go on to the lymph nodes. But what is the function of these lymphatics? They are part of the immune system. So it's very, very important because they drain what is called the waste products from the tissues. So in Kannada, it's called rasa. Probably in Hindi also it's called rasa. And it is the tissue fluid which is drained by these lymphatics, and eventually they find their way to the blood vessels, through the heart, to the circulatory system, the kidneys, and it comes out. So if you examine this rasa, what is it made out of? It is made out of fat, made up of fat. It has some cells, it has some bacteria, it has water, and it has a lot of protein in it. So this is what is called the lymphatic system and the lymph fluid. But what happens? Why do we get this lymphedema? Edema means swelling. Lymphedema, swelling of the lymphatic system. So what happens in lymphedema? There is a collection or accumulation. This whole hand becomes swollen. And this swelling is because the fluid is stagnant there. It is not flowing. So like an overflow, it does not drain properly. So it can occur in any part of the body. I told you lymphatics are all over the body. So it can occur in any part of the body. Sometimes we see it visibly. Like if it happens in the hand, we can see it. Supposing many of you have had breast surgery, you could have had breast conserving surgery also. But many of you may not even realize that you have swelling of the breast. You could have a lymphedema in the breast. You think, operation I2, it's swollen, radiation I2 is swollen. But actually there could be lymphedema in the breast. Many times when we are traveling, right? Long journey, bus journey in the car, you're sitting for a long time. In the morning when you wake up, you find your feet are swollen. So most likely those things are lymphedema. So it can come and go. When you start walking, when you start exercising, the lymphatic tissue, the lymphatic fluid moves, so the swelling goes away. But when despite movement or despite exercise of the swelling doesn't go away, then it causes a chronic swelling. That is, the swelling is there for it to stay. One other important thing which you must remember is, unlike the blood vessels, the veins and the arteries, there are no valves or pump for the lymphatic channels. So for the arteries and veins, you have the most important big pump called the heart, and there are valves. But for the lymphatics, there's no pump. So only by movement, I'm talking about a normal person who has no medical problem at all. Even for that person, only with movement, the lymph will move. That's why we keep saying don't sit for too long, especially if you sit in unsoft, very, what do you say, couch or cushioned sofa for a long time watching TV, 2 hours. Just imagine all the lymph is pooling into your pelvis and lower abdomen and the legs. It is so dangerous. Only that's why we say every half an hour get up, walk. And another important thing is massage. If we don't do it regularly, of course, just our movements, exercises itself is a form of massage. The older Indian custom, which not many people follow these days, is the oil massage, which people used to insist that we have twice a week or something, right? Which was such a good thing actually for lymphatic drainage. But nowadays we don't do it. Maybe once a month or something, people do it. So if you get the swelling, it increases your risk of skin changes. Any swelling for a long time could result in hardening of the skin, ulceration, some damage, risk of infection, especially if you're a diabetic. Yeah. So today we are talking about lymphedema, which follows breast cancer treatment. All right. So we are in this area of supportive care. So it's a very important thing that we need to know. When you talk about, say, when a person comes with a diagnosis of breast cancer, first thing they come and ask me or any other doctor is, will I lose my hair? That's a very commonly known important side effect of cancer treatment. Very few people know about lymphedema also. Even as doctors, we don't tend to focus on it. If somebody comes for a with a breast cancer diagnosis, we don't say one of the most important side effects of treatment is lymphedema. We never talk about it. Only after surgery, we'll tell them, yeah, you could get swelling of the arm, so don't have injections there, don't take your BP there. Those kind of things we tell them. But the incidence is almost as common as 1 in 3 women who have had treatment for breast cancer can develop lymphedema. Can develop, not necessary, they will develop. Even though the incidence is supposed to be 1 in 3, 1 in 3 have a risk. But like I told you, there are so many people, almost 70% of the people don't develop. So what is it that we're doing right or not doing right, which precipitates this lymphedema? We are still yet to find out. But there are a few things we know we can do to prevent it. So when can it happen? It can happen soon after surgery. It can happen a few weeks after surgery. It can happen after a few months, and you can have a lifelong risk of lymphedema. That's why it's important to understand what you can do to prevent it. So who is at risk of developing lymphedema? First of all, any swelling in any part of the body which is pressing on lymphatic tissue can cause lymphedema. Untreated breast cancer itself can cause lymphedema. Now, if you have had surgery and radiotherapy to the breast, what we are doing is we're cutting off the lymph channels. So what is a straight, nice path or a network? We are interrupting it. We're cutting it off. So we are not allowing the fluid to flow freely. We are creating a traffic jam. So if we are removing lymph nodes from the armpit, then the risk is a little more. Nowadays, many of you may have heard surgery where we are doing only a sentinel lymph node biopsy. For not all people have, because nowadays the type of surgery that we're doing has become less and less radical. So many people don't have lymph nodes removed from the axilla completely. We do only what is called a sentinel node biopsy. And if that is negative, we don't remove the lymph nodes from the armpit. If it is positive, we go ahead and remove. And many times, if we are doing a mastectomy, the whole breast is removed, then we don't give radiation at all. So these are the permutation and combination in which the way treatment happens. So if you are undergoing surgery, if you are undergoing radiotherapy, if you remove lymph nodes from under the armpit, all these will increase risk. Why does radiotherapy increase risk? Because it causes a lot of scarring, fibrosis, etc. Now, the other important point to remember is if you put on weight. If you are overweight, if you put on weight, definitely it adds to the risk. Even for a normal individual, overweight, obesity increases the risk of swelling and lymphedema everywhere because it just doesn't prevent it doesn't facilitate the lymph flowing freely. Now, if you're a diabetic, if you develop some infection, even if you're not a diabetic, if you develop infection in that arm or on the skin, if you've got eczema, if you have itching, if you have some insect bites, all of those things will increase your chance of developing lymphedema. So how do you know that you can get lymphedema? Like I told you, when you're traveling, sometimes your foot is swollen. So yes, that is lymphedema, but it goes away after walking or doing some exercises. After surgery for breast cancer, if you notice, soon after surgery, many people normally can have a little bit of lymphedema. That's nothing to worry about, but you must start exercise from day one. The kind of exercises you need to do, we'll be talking about later. So first thing you'll notice is if you're wearing a ring, if you're wearing a watch, especially Indian women wearing saris, notice the blouse on that side, the arm on that side, the sleeve becomes a bit tight. So you could develop some pain, ache. You can find difficulty in bending your knuckles like this, the fingers or your elbow. And sometimes you can, if you just let it go unnoticed, you can develop some thickening of the skin. So that's why even a self-massage is very important. If you just run your fingers like this, you'll notice any changes in the skin and you can be very aware of what is happening to you. So this picture shows you the different stages of lymphedema. See, in stage 1, you can barely see that there is a swelling. So usually soon after surgery, this is what it will look like on the affected side. Stage 2, slightly more, and stage 3 and stage 4, of course, it's quite bad. And also the feel of the arm. So you can feel it is very soft in most of these, stage 1, 2, 3. Stage 4, it becomes very stiff. So then stage 3 and stage 4, we can't reverse it. Stage 1 and stage 2, you can easily reverse it. I'm not going to talk about primary lymphedema here. Primary lymphedema is absence of lymphatics and all that, which is a congenital problem. What we are seeing following breast cancer surgery is secondary lymphedema. And like this picture shows, stage 1 and 2 is mild, stage 3 is moderate, and stage 4 is severe. So please remember stage 1 and 2 is reversible or can be kept absolutely in control. Stage 3 is also partially reversible, you can keep it in control. So why am I talking so much about lymphedema? Why are we having this session? Why do we frequently talk to people about lymphedema in supportive care? Is because first of all, you must understand, you must recognize that there is an entity like this. Many people, even some of the older patients who finished breast cancer surgery 15 years ago, have no idea of lymphedema. Suddenly they come with a slight swelling and they'll say, you know, what happened and things like that. So very important to be aware, point number 1. Second is, it really affects our quality of life if we don't pay attention to it. So first of all, it's an unpleasant reminder, you know, I had breast surgery, that's why I've got this lymphedema. It affects our body image, especially if you have a swollen arm. We are lucky because we get to wear saris, you know, salwar with a dupatta. To some extent, we can cover it and be comfortable, but still, it's an unpleasant thing. And once you have to take care of it, it becomes a lifelong thing. It's very time consuming. So like I said, you can't figure out who will get or who will not get, but definitely you can prevent it. So now coming to the management of lymphedema, there are 4 important aspects to it. One is you have to be aware, right? So you have to be very familiar, just like you've heard of breast self-examination, you have to be aware of what is happening in your body all the time. It's not just for cancer or, you know, this breast self-examination or lymphedema. I'm saying as an individual, we have this body of ours. That's the only place we have to live in for the rest of our lives. We have to be aware of each and every part of our body. Every morning we spend some time looking at the mirror, at our face, or doing our eyebrows, powdering our face, whatever. Please be aware of the rest of the body. This is applicable for both men and women because you can have a new development anywhere. in your body, and many times we don't pay attention to it. We're always rushed, having a bath and things like that. We don't pay attention to, say, a mole which is increasing in size, an ulcer which is worsening, bleeding from the nipple, skin thickening. All of this we need to be aware of and seek medical attention immediately. So the 4 things for lymphedema care. First and foremost, skin care. Second is doing exercise. Third is wearing compression garments. We'll show you all of that. And the fourth is manual lymphatic drainage. So the exercises that we are going to show you today are both from the physical regular exercise and also the yoga therapy. So what is the aim of this management that we are talking about? One is, most important, what you can see physically, what is tangible, is to bring down the swelling of the hand. And the second is, once the swelling has occurred, how can we maintain it to be either free from swelling or keep it under control? So skin care is most important. Even those who do not have lymphedema, please understand that you have to take care of your skin. So you must moisturize it every day. Do you know that skin is the largest organ in the body? It's not the brain, it's not the liver, not the spleen, not the heart or the lungs, it is the skin. So it is the first line of defense. It's the one which gives you protection. So you must pay attention to it. You must moisturize it. I forgot to ask if everybody is okay with English. Anybody wants to interrupt and use any other language?
Yeah,
Everybody okay?
Little bit of Kannada on and a little bit of Hindi should be fine.
Any requests so far, Kripa? Just check.
Not on the chat so far.
Okay, fine.
Yeah.
Then we'll just
Okay.
speak in Kannada later.
Yeah.
So you must protect your skin. You must moisturize it every day. How do you moisturize it? You can use pure coconut oil. You can use olive oil. You can use Vaseline. You can use Nivea cream. Any of those mild, bland moisturizers. Nothing which is heavily perfumed or any other synthetic chemicals as additives. So every day, whether you have lymphedema or not, you must take care of your skin. So soon after a bath, try to apply any of these moisturizers, coconut oil, Nivea cream, Vaseline, whatever you feel like. It should be a mild thing. No, the operated part and the affected limb for sure. But you may as well apply to the rest of the body, right? Why leave it unattended? So you always have to keep your skin clean and dry. I know as women, we all have to do a lot of housework. We tend to keep our kitchens clean. We want to wash the vessels. We want to do some gardening. All of that you can do. Please don't avoid doing everything. You can do, but make sure that you protect your skin. If you're doing any heavy duty work, wear those nice gloves. Everything is available on Amazon now. It's worth it. So please invest in those big rubber gloves, which will keep your skin clean and dry when you're doing heavy duty work. Don't use very harsh detergents, chemicals without wearing gloves. And if you get a cut or you just scrape your elbow or knee or whatever, please make sure that you attend to it immediately. Clean it, apply some local antibiotic cream, etc., and protect it. Also protect yourself from insect bites, especially if you're working in the garden, especially when there are too many mosquitoes in the house. Make sure that you protect it from all of that. You can use any of those lemongrass sprays, anything which is natural and no harsh chemicals you can use. If you are going out in the sun, especially people who live in in winter, especially the sun tends to be very harsh. So make sure that you protect your skin from the sun. You should wear a sunscreen, wear a hat, whatever, when you're going out. And use an insect repellent, especially if you're going out on picnics, going out somewhere for a drive and things like that. Please do that. So that is about skin care, which is very important. Whether you have lymphedema or not, all those who have been operated for breast cancer must massage the area of the operated site. Especially you will find that the skin on the breast, skin in the armpit, all of that becomes very tight. So just to loosen the skin itself, a daily massage, just gentle stretch. Supposing you have a scar like this, just press the scar away like this, gently stretch. You'll find that over a period of time, that skin becomes very soft and loose and pliable. So that helps the lymphatic flow to, be very normal and get back to normal. If it is a very thick fibrous scar, then the lymphatics get caught in that, and again there's a block. So you can yourself do this massage regularly and help to keep the skin very supple, soft and healthy. So now we'll move on to exercises. Sneha will, our physiotherapist, will be showing you how to do that.
Hello, good morning everyone. Thank you all for being here today. So Dr. Sandhya already explained in detail as to how the lymphatic system works and what is lymphedema, and paying importance to skincare is so important. So equally important is the exercise. So as we know that the lymphatic vessels are not as arteries. So if we can just understand how exercises actually help in draining the lymphatic fluids. So just like for arteries, there is a pump. So what is a pump? The heart pumps the blood. So there is a constant pressure from the heart that the vessels get, because of that pressure, all the blood circulation is it happens round the clock. But in lymphatics, if you can just observe this video on screen, so lymphatics, what happens is it is dependent on the muscle contraction for its movement. So if you can see here, when the muscles are contracting, that's when it pushes the lymphatic circulation, right? The lymph fluid starts to circulate better with the contraction of the muscles. So there is no pump as such. So the lymphatic circulation is largely dependent on physical activity and body position. So that's why exercising regularly is very important. Right. So what are the benefits of exercise? First thing is doing regular exercises definitely helps you in your day-to-day health and activity. Apart from that, for lymphedema especially, like we just saw, skeletal muscles help in pumping the lymphatic fluid, and it doesn't allow any accumulation in one place. So if we keep stretching and if we keep doing exercises and good physical activity, then automatically the lymphatic circulation also increases. So it can be anything like walking, swimming, running, etc. They are all good choices for maintaining good flexibility, fitness and a sense of wellness. So exercising improves the strength of your arms also, because right after the surgery, we observe that the side of the surgery, usually there will be weakness of neck to arm muscles, which can reduce your day-to-day activities. Like it makes it a little difficult. So exercising can help you regain that strength. So for lymphatic circulation, for your overall fitness and for your strength, exercising is extremely important since day one of your surgery. So if we can just look at what are the different kinds of exercises that you can follow. These are simple exercises that you can do. I would recommend all of you to actually practice, do these exercises now as position. So all of you kindly join with us and do these exercises. So first one is the neck roll. First, your neck is in straight. Keep your neck straight first. Then firstly, try to take it back and front. Just do this 3 times. Again, repeat it and come back to starting position. So another neck exercise is looking towards your right and left. Again, right and left. Right and left. Now try to bring your ears towards your shoulder. 1. Again the other side. 2. I hope all of you are doing this with us. Right.
Yes. Kripa can tell us. Kripa, are they all doing it?
Kripa, are they all practicing along with us, like as we are doing here?
Yeah, I think so. Most of them are. Yeah.
That's great. That's great. So these exercises, as initially when Dr. Sandhya explained where the lymph nodes are. So here near the neck and around the shoulders, near the breast, near the abdomen. So we are all focusing these exercises to get those lymphatic nodes activated, right? So let's just move. Let's look at the next exercise. These are shoulder shrugs. So what you have to do is just raise your shoulder and hold. 1, 2, 3, 4, 5, down. Let's repeat that again. 1, 2, 3, 4, 5, down. Again. 1, 2, 3, 4, 5. Right? So let's go to the next exercise. These are shoulder retractions. Bend your elbows and just take your shoulders behind. The shoulders should go behind your ears, right? So, let's do that. Take your shoulders back, hold. 1, 2, 3, 4, 5. Relax, come back to the position. Again, take it back. 1, 2, 3, 4, 5. Relax. Last time, let's take it back, all of us together. 1, 2, 3, 4, 5. Right? So you must all be feeling a little tingly around your shoulder and neck now already because all your muscles are activated. Right? Let's go to the next exercise. So these are wall press and wall squats. What you can do here is, you can demonstrate. Yes. So what you can do is, so just go towards the wall, bending your elbow and push your palms and come back. Yes. Can you repeat that again? Very good. 2. Again. 3. Just last one more time. Can we do it? Excellent. So this is very important for strengthening your girdle muscles, right? So the next one is called scapular setting, where you stand a little closer to the wall with your forearm touching the wall. So what you do is, bring it here, get your forearm touched, and now bring them together here, join them. So relax your shoulder here. Yeah. Just slide your shoulder up a little more. Meet it here above your head. Yes. Yes. 2. You can see. So this will help you stretch the. Okay. Let's come back. So this will help you move your, mobilize the lymphatic tissues in your upper back and also help strengthen your upper back muscles, right? So moving on to the next one. This is knee to chest. You can simply lie down. Just bend your knee and bring it towards your chest and back. So this is another simple exercise which will help move the lymphatic, lymphatic fluid near the abdomen and pelvis, right? So all these exercises are just designed to mobilize the fluids from all parts of the arms and shoulders towards the nodes. Okay, so for one thing you have to remember, these are general exercises that everyone can do, but there are specific exercises which you need to get prescribed from an expert, so that you are assessed properly and given the right exercises, right? So you have to consult the expert before starting any of these exercises, right? So that's about the exercises. We will deal with yoga exercises a while later. Before that, I would want to introduce manual lymphatic drainage. So if you can remember, lymphedema management has 4 things. One is the skincare, that is extremely vital, that Dr. Sandhya discussed. Second thing is the exercise, which we just now discussed. Third thing is manual lymphatic drainage. So here, what is manual lymphatic drainage? Manual is you doing the, manually you are draining the lymph. So now that we know that the passage through which the lymphatic fluids move, that has been blocked at some area, some point here. So what we try to do is we try to drain it manually. So here it involves gentle pressure. Gentle and rhythmic pressure needs to be applied over the skin. So just below the skin, the lymphatic fluid moves. So the amount of pressure that you have to apply is also very gentle. So start draining the unaffected side and then move towards the affected side. So if we can just simplify this, if you can recall, there are certain nodes like in the neck, near the armpit, near the chest, upper back. So these are nodes are nothing but they are collecting places. So the fluid from all of my upper limb will probably go and collect near my neck or in my armpit. So these are collecting areas. So during surgery, what would have happened is these collecting areas, or the go downs, what you refer, what you can think of, these will be removed. So there will be no place for the fluid to drain from here and go and store, right? So that's why what we have to do is we have to push all of these to the good side. So here all my nodes are working and they are fine. So what I will do is, instead of draining them here there is nothing, isn't it? So I will try to drain them to the other side, as in where the lymph nodes are active and they can take the fluid and get rid of the lymph. So the idea is to cover the entire limb and direct the lymphatic fluids towards the unaffected side. As in, if this side I have got my surgery, I will try to drain the fluid from this part to the other side, right? So if you follow the massage in a sequence, it is definitely better. You should not use any kind of oils for this particular massage. So you should do it every day, preferably after a bath. So let's just see what does this involve. So I spoke about the amount of pressure that needs to be applied to do this massage. Let's just look at what is the amount of pressure that you have to use. So if you can look at the screen, it's just that she's moving her skin, right? It does not involve a lot of pressing and a lot of rubbing. No, it is very gentle and she's just moving her skin tissue. Again, so you have to remember that you should not feel any kind of pain while you do this. There should be no reddening of skin, and don't use any kind of lotion or oils. So now that you've understood the amount of pressure that needs to be put to practice this manual lymphatic drainage, So let's move to the sequence. So this is a regular, generally this is a sequence that we give. But the main point you need to understand is your neck nodes, your armpit nodes, all of these needs to be drained. And whatever exercise and yoga that we are going to teach you, they're all designed to empty these areas mainly. So second point is you have to drain from unaffected side first, and then you have to bring it to affected side. So if I can just explain this a little more, as I told, here there will be a lot of swelling, but here the lymph nodes are working. So if you have to get the fluid from here to here, this needs to be empty. This needs to be empty so that it can accommodate the fluid from this side. So what you will do is, naturally you will empty this side first. So you will perform the manual lymphatic drainage here on the unaffected side first, empty all the lymph nodes, right? Or the godons, or the units which collect this lymphatic fluid, and then you get it from the affected side. It's simple. So you empty here, there is space. Here there is a lot of fluid. Then you bring it to the empty spaces on the other side, right? I hope I'm clear with this. First you have to drain on the unaffected side, and then you have to drain on the affected side. So these are the sequence that we give for upper limb and lower limb, which you can follow, right? So an example of upper limb, see, first what they do is they drain the neck first. They're emptying all the armpits on the unaffected side. Unaffected chest means the side that is not operated, the good side. The operated side is affected side. See, first what they've done is, the unaffected side or the good side is first emptied, and then from the affected side or the surgery side, they are bringing the fluid towards the good side because it is empty, right? So this is the idea behind it. So if we can move on and just see the
people who have been,
yeah.
So people who have been operated for ovarian cancer, uterine cancer, sometimes you may get lymphedema in the legs. So then it's good to do this kind of massage. Sneha, I'll show you the video.
So you are covering all you're covering the entire limb. So you're taking one segment at a time. So here if you see in 3 strokes, she's covering the entire front of the thigh. Now she's moving towards the knee, like that. So entire area of the arm is covered. Arm or the leg is covered.
It's always towards the heart.
Yes, and the direction of the movement, it's always towards the heart. So we never do the massage towards the end of the limbs. It's always towards the heart. So if you see, the pressure is very gentle. She's making sure she's covering the entire area, right? So this is how you can practice. So that ends the manual lymphatic drainage. Now coming to bandages, Dr. Sandhya will be taking it.
So we spoke about exercise and massage and how that can help. The third most important thing is compression bandages. So the minute, remember what I told you about symptoms, you'll start feeling the hand is slightly heavy. How do you know you have lymphedema, right? Your slight swelling, your rings become tight, your watch or bangles become tight, your blouse on the affected side becomes tight. The minute that happens, it is a good practice to use compression bandage. Why do we need a compression bandage or a sleeve? is because it will give a tight, constant massage. So if you see this picture, what this lady is wearing, this skin colored thing is a compression bandage. So even before you actually meet a doctor, it is good to have anybody who's undergone surgery for breast cancer, it's good to have this as a precautionary measure at home. It's just like, what shall I say, like we have first aid kit, no? Like that you can buy one and keep. Of course, you may have to change it. So maybe, don't buy a very expensive one, but just as an emergency measure, you can keep it. And it's a very good way it is designed is near the hand. It is tight. And here it becomes like a proper fit. And it will always be a slight tight fit because it has to give the pressure to push the lymphatics. Because like we said, lymphatics don't have any pump or valves. They have to be pushed only by movement. So this is how the sleeve helps. So once you get grade 1 or 2 lymphedema, once you start noticing heaviness, please use it. This may not be a permanent thing. After a few days, you can get rid of it. I don't know if Rajini is there today, but she had this experience of wearing the sleeve and the swelling came down and now she's without the sleeve. So very early in the occurrence of lymphedema, if you start using the sleeve, there's a very good chance that you can reverse it completely. And wearing a sleeve, you must always do your exercises, all your work when you're wearing this. I will demonstrate how you can wear it. There is Sharda with us. Here we have two of our Sahai participants. This is Dr. Sharda and Manjula also. They are here physically in the center today. So maybe I'll demonstrate with Sharda. Sharda has a lymphedema. It's a very prominent one, but she has taken good care of it. So her skin is very soft, supple, and even though, there are many other contributing factors like the deposition of fat and things like that, but really the lymphedema is not of like pathological concern. Yes, cosmetically it looks different when compared to the opposite side, but she's managed it very well so long and kept it very soft, it's very soft and very pliable, very pliant. So you have your sleeve. I can show you how to wear the sleeve. Now the other thing is there's a lot of lymphedema care which manages with bandaging. This is a very cumbersome process, okay, where you have to bandage completely, keep it for 24 hours. You need a therapist to do it for you because you cannot do it by yourself. And that is more for, lymphedema which occurs very suddenly and we want to reduce the swelling and the pressure, acutely. Over a period of time, maybe a week or 2 weeks, you will require this bandaging. So it is our duty to see that we don't allow it to become like that. So you have here another sleeve which Dr. Sharda uses it. So usually these sleeves are measured to your arm. There are some ready-made sleeves, but they may not fit you exactly. So you can fold it like this so that you can put it on easily. And you can do it yourself. You don't need help actually. And then you pull it up. So you will find that it is a bit tight and uncomfortable first. You can have somebody standing behind you. You have to make sure that the top edge of the sleeve does not cut into your arm. So there should be no folds or wrinkles because that again will obstruct the flow of the lymph. So if you pull it up tight like this, it's very good. So you get skin colored ones, you get one with good elasticity. You have to buy two always so that you can wash one. When you wash it, the elasticity comes back. And depending on how you use it and how you wash it, you may have to replace the sleeves when it becomes loose. And it's usually it lasts for about 6 months or so. Then you'll have to replace it. But it's a very good thing for you to wear these sleeves so that, the pumping action is there. Yeah. and pumping action will always be there. So the other thing that you must remember is whatever exercises Sneha has showed you, what Swati is going to show you now, when you have lymphedema, you have to wear the sleeves only and do the exercise. So the only time you need to take out the sleeve is when you're going to bed. So many people also ask, when I'm traveling, should I wear the sleeve? If you have lymphedema, you can wear. If you don't have lymphedema, a lot of people ask, if I have long air travel, should I wear the sleeve? Now, a lot of research has been done and it's shown that you don't need to wear the arm sleeve when you're traveling if you don't have lymphedema. Now, when it becomes stage 3 and 4, also like I told you about bandaging, right? So that's a very cumbersome process. You have to have short level bandages. It's not one long thing. So this is the arm sleeve which we showed you. Because bandaging is from case to case. Not everybody will require bandaging. We are showing you only the commonly used, frequently used, and what needs to be done on a regular basis by people. So in grade 3 and 4 lymphedema, sometimes in grade 2 when the swelling is a little massive, we have what is called a compression pump. You can see the picture here. We also have it with us. So this is it. You can see it's similar to what that lady is wearing in the picture. And you put your arm through it. It has segments 1, 2, and 3. So the pumping action starts from here. First, this will tighten. So this is the machine. This is the machine which comes with that. So this is connected to the electric power, and it is a pneumatic pump. So it is a multi-chamber sleeve. So this is one chamber, the middle one is the other chamber, and this is another chamber. So gradually, sequentially, it will start contracting. When you wear it, you will have to wear it for about half an hour to 45 minutes to 1 hour, depending on the severity, once or twice a day. So first this will tighten, then this will tighten, and this will tighten. So three ways in which, 3 areas in which the tightening happens, and it's this continuous process. You do it for about 45 minutes to 1 hour twice a day. That will help to pump. What we have developed in Prameya is how Dr. Sharda has also managed to keep it soft is we were using a BP cuff. You know, the older manual sphygmomanometer, the mercury BP cuff. So we use it here, but you have to do it with guidance. You cannot do it yourself. You have to go to a clinic or somebody who's familiar with the process. So you can use that as this same thing as the manual compression, the pneumatic compression. So that also will help to drain the fluid. After that, you have to wear the arm sleeve and continue your work and so on. So the best thing we recommend is as soon as you wake up in the morning, before you get, because as women, we get caught up in all our daily activities. So you have to give yourself me time, about half an hour every day. Where soon after a bath, probably the first thing that you do is certain lifestyle changes you can make. You can go have a bath, finish your massage, wear the sleeve, then come out, then you're done for the day. Throughout the day, you can do your other exercises which Sneha taught or what Swati is going to teach you now. So now we are done with, you've heard about skincare, how you can manage your skin. You've heard about compression sleeves. You've heard about massage techniques. And you've heard about simple exercises that you can do throughout the day. The neck exercises, shoulder shrugs, all of that you can do throughout the day. Now Swati is going to take us through some yogasanas. We recommend that all of you, whether you have lymphedema or not, please do it. These are very, very useful exercises for everybody. Yes, Swati.
Hello, Namaskara. Okay, now we'll be doing few postures. So what will happen if you do these postures is, as Dr. and Sneha told, your lymphatic system will be more active. So your hardening of the hands, swelling This is to avoid, and those who have got lymphedema, it helps to reduce it. Okay? ಯಾರ್ಯಾರಿಗೆ ಬಂದಿದೆ, ಯಾರ್ಯಾರಿಗೆ ಬಂದಿಲ್ಲ, ಎಲ್ಲರೂ ಮಾಡಬೇಕಿದೆ. Okay? So now I shall show few postures. Dr. Sharda and Angela will show with me. So, nidhanake, kai mele, stretch your arm, right arm, and take it to the left shoulder. Okay, to your left shoulder. Hold it with the left arm and just stretch it. Just stretch it slowly. Nidhanake. So, reverse hardly. You should go downwards and open up, and the stiffness in your arms will reduce. Okay? How long should we do? At least for 3 to 5 breathings, or you can count 12. Okay? Slow counting. So again, left hand the same way.
Hello, we had a technical snag. Just give us a moment. Yeah. I think.
Yes.
Yeah, Sneha, I think we can see you now.
Yeah. So this is one of the easiest one, and you can do it anytime. So preferably try to do it twice in the morning or in the evening. This is just rotation of the arms. Tallod beda. So you can just see, just stretching in line with the shoulder. Bhujada line nalli nidhanake stretch ಮಾಡಿ ಅಲ್ಲಿ ಇಟ್ಕೋಬೇಕು. So what happens? All the muscles slowly starts working and strengthening. ನಿಧಾನಕ್ಕೆ ಕೈಗ ಸ್ನಾಯುಗಳು ನಿಧಾನಕ್ಕೆ ಸ್ಟ್ರೆಂಥನ್ ಆಗುತ್ತೆ, ಬ್ಲಡ್ ಸರ್ಕ್ಯುಲೇಷನ್ ಆಗುತ್ತೆ. ತಳ್ಳಬೇಡಿ, ತುಂಬಾ ಸ್ಟ್ರೆಚ್ ಮಾಡಿ ಅಷ್ಟೇ. ಎಷ್ಟಾಗುತ್ತೋ ಅಷ್ಟು ಸ್ಟ್ರೆಚ್ ಮಾಡಬೇಕು. You need to stretch it, straighten it. Okay, just push your wrist, the root of the wrist. Next one is outside. Just turn the fingers outside. No, they can see. They can see it. Okay. Then is inside. Downwards. Sorry, downwards. So here there will be a little difficulty because of the stiffness. So try to do as much as you can. So ಎಷ್ಟಾಗುತ್ತೋ ಅಷ್ಟು try ಮಾಡಿ. ಆದ್ರೆ ಕೈ ನೇರ ಇರಬೇಕು, ಭುಜದ ಲೈನ್ ಅಲ್ಲಿ ಇರಬೇಕು. Be in line with the shoulder and stretch it. So strengthening of the upper arm, your forearm, elbows will happen. Then inwards. Yes, rotation inwards. So all the 4 sides of your arms gets activated and strengthened. Okay. It will improve the lymphatic flow. Okay, and strengthen your arms. Stiffness will reduce. Okay. So how long should you do this? At least count for 12 to 15 counts. Each place 12 or 15 counts. Then again 15. then down 15, then inwards 15. So that will help you to keep your arms strong and activate your lymph nodes. Okay. Next one is sitting down and stretching. I shall just show you. That's nice. Thank you. Now, so stretch the arms. First, stretch your arms up. Extend the spine. Then take the right arm. Inhale, exhale. Shaka will be doing left arm. Manjula will be doing right arm. Nera. Nera. Try to stretch the right arm straight and stretch the left arm up. Okay? Breathe well and comfortably. Stay there for 4 to 5 breathings or for a count of 6. Now inhale, arms up. Exhale towards your left. Should we do only for the arm which is affected? No. It should be done for both the arms. ಯಾವ ಕೈಗೆ ಲಿಂಫೆಡೆಮಾ ಆಗಿದೆ ಅದೊಂದೇ ಕೈ ಅಲ್ಲ, ಎರಡು ಕೈ ಮಾಡಬೇಕು ಈಕ್ವಲ್ ಆಗಿ. Inhale, come up, arms down. So try to do it at least twice. ಎರಡು ಸತಿ ಟ್ರೈ ಮಾಡಿ. ಇದು ಮಲ್ಕೊಂಡು ನೀರನ್ನು do it. ಇದೇನಿಲ್ಲ, once inhalation, ಒಂದು towel ಅಥವಾ ದುಪ್ಪಟ್ಟ, towel or ದುಪ್ಪಟ್ಟ. Keep your towel or dupatta, lie down, stretch the arms up behind your head. Inhale and stretch it up. Exhale and get it near your stomach, or near your thighs. Okay? So inhale, slow movement up, and exhale, slow movement down. Try to do it at least 10 times slowly. 10 sati madre olledu. So slow movement it should come. Inhalation, you should take it up. Exhalation, you should get it down. Okay, next one. This is arm stretching. Again, you should stand sideways and keep your arms down and rotation.
We lost you, Swati. Hello, Swati. Kindly wait, please. Yeah. Swati, we can't see you. Only the presentation. Can you hear me?
Yes, yes, we can hear you.
Yeah.
Now,
now we can see you. Yeah.
can you see us? Can you see us?
Yes.
Krupa,
Yes, we can see you, Swati.
can you see us?
Yes.
Okay. So this is called as Hasta Vistara. So it is just extending the arms sideways. First we did facing the wall. So now it is sideways, strengthening, stay there for again 15 counts. Okay. Then you can do the other side also. Both the arms should be done. After this practice, yes, be in line, and it should be in line with the shoulder, the arm. Don't take it up or down. ಮೇಲೆ ಅಥವಾ ತುಂಬಾ ಕೆಳಗೆ ತಗೊಂಡೋಗ್ಬಿಡ್ಬೇಡಿ. Okay, down. See, after this practice, don't cheat. After this practice, you need to do this. So this helps to strengthen the arms and keep your lymph nodes active. So only after practicing all these, you can do that. Taking it back, L shape, 9 o'clock backwards. Yes. Okay. Taking it backwards. So movement, you'll get good movement, strengthening, activation of your lymph nodes will happen in this. Back slowly. So these are simple stretches you can do while sitting. Just sit and stretch. So while watching your TV noduvaga, sumne kitchen alli sumne ninkoduvaga, you can do this. So you're just sitting, watching serials or in front of the kitchen, waiting for your milk to boil or something. You're just talking to somebody, you can keep doing stretching. Okay. Next is Ardhakati Chakrasana. So this also you should go close to the wall, very close to the wall. So which hand is up, that leg should be very close to the wall, feet. Then there should be a distance between the legs as wide as your waist. Sontada Shtagla, right? Just keep your legs as wide as your waist. Then inhale, stretch the right arm which is near your thighs. And exhale, stretch towards the right. Sontada bhaga, your waist will be touching the wall. You're coming only from your side ribs. Okay? Your side ribs are open, stretching. So blood circulation happens downwards, strengthening of the arms also happens. And your waist is touching the wall. You're not coming away from the wall. Only your side ribs are opening. Okay? Again, this should be done both the sides. Thank you. So do it with slow, soft breathing. Okay. Next is, this is for, as Dr. Sandhya said, for the central lymphatic nodes to get activated and pumped up. So here, I'm using a chair. I'll be using a chair. Here in the picture, there's a sofa I've used. Here I'll use the chair. So first, stretch the arms, face the chair and extend. Extend. Okay? Stay there. Breathe well. Extend the spine. Breathe well. After a few practices, after a few days, of at least 1 week, then take your arm and hold the chair's leg or sofa, reduce the height. Keep it down. Then again on the floor. Stay there. Now, contraction of stomach. Then head down. Stay there. So 1, 2, 3, 4 and 5. So whichever is comfortable in the starting. Start off with the chair seat first and then start to improve and take it down. So this helps for your central lymphatic nodes to get activated and pumped well. Okay? So, yeah, you both can sit right. So this is asana. Many of them come after going to yoga classes and they say, I did Surya Namaskara and I got bulged. That is because some people will not know how to put pressure on the hands and how to extend it upwards. So kindly do not do these postures if you're going to any other yoga classes. That is Surya Namaskara, you shouldn't do because you're putting a lot of pressure in.
Swati, there is a screen freeze. Unable to hear you. Hello.
Are you able to hear us?
Now yes.
Are you able to hear
Yes.
Okay.
Yes.
Okay. We'll start in just a moment. Yeah.
So Sorry for the interruption. A lot of net. Suddenly it's going. So, Surya Namaskara you shouldn't do. Adho Mukha Svanasana, I've shown in the picture. Putting hands down and pressurizing shouldn't do. Only those who are experienced, and after using few frogs, I
Swati, looks like there is a problem again.
Okay, so these are the few postures which you shouldn't do. Now we'll do a few breathing. Simple, deep breathing techniques which help you to keep you calm and relaxed and help your mind to relax. So once we do that, the blood circulation, the heartbeat, the complete physiological system of your body will improve. Okay, so just sit straight comfortably on the chair. Close your eyes gently. You're doing slowly on the floor. Let me also do on the floor. Sit straight, comfortably. So keep your right hand on your stomach. Balagai hotte mele. When you inhale, see, while you're climbing your steps and climbing down, there's a different speed sometimes or very fast. Mettal hattavaga athwa iliyovaga, we either climb fast or slow. Now I'll teach you two Ujjayi pranayamas where you should climb steps slowly, climb step fast. That is, while you inhale, you should inhale normally. While you exhale, you should exhale slowly. So think you're climbing the steps down very slowly. Okay, got it? Usur togolavaga sahajavaga usradbeku. Usur bidavaga nidhanake eshtu nidhanakagutte ashtu nidhanake usur bidbeku. Usur togolavaga hotte ubbariಸಿರಬೇಕು. Usur bidavaga nidhanake hotte olaga ಹೋಗ್ತಾ ಇರೋದು ಗಮನಿಸಬೇಕು. So while you inhale, you should observe the abdomen bulging. While you exhale, you should feel the abdomen contracting little by little by little. So that you exhale very, very slowly. Okay? So close your eyes. We shall do that 3 times. Inhale normally. Exhale slowly, deeply. ಎಷ್ಟು निधानक्कागत्ते अष्टु निधान. कितना धीरे से कर सकते हो उतना धीरे से श्वास को छोड़ना. Slow inhalation. Exhalation should be slower and deeper than your inhalation. Third time, inhale. Slowly exhale. This was exhaling slowly. Now we'll do inhaling slowly, exhaling normally. That is, you're climbing the steps fast, You're climbing the steps in a normal speed. Okay? So you should inhale very slowly and deeply. Nidhana usuru tagobeku. Arama usuru biಡಬೇಕು. So usuru tagoಡುವಾಗ ಹೊಟ್ಟೆ ಉಬ್ಬರಿಸಬೇಕು, ಎದೆಯಲ್ಲಿ usuru ತಗೋಬೇಕು. It should go in the lungs slowly. So lungs should broaden up sideways and abdomen should bulge forward. Okay? Again, keep your hands on your stomach to be aware of the breathing. Inhale. Slowly, deeply fill your upper, mid, lower lobes, lungs. Exhale. Inhale slowly, deeply. ಎಷ್ಟು ನಿಧಾನಕ್ಕಾಗತ್ತೆ ಅಷ್ಟು ನಿಧಾನಕ್ಕೆ ಉಸಿರು ತಗೊಳ್ಳಿ. कितना धीरे से आपको श्वास ले सकते हैं, उतना धीरे से श्वास लो और आराम से श्वास को छोड़ो. Exhale normally. Last time. Inhale slowly, deeply. Exhale. So this was a normal Ujjayi Prakara 1 and 2 to keep yourself calm, relaxed, strengthen your lungs, keep your mind. Okay, so I hope you all practice these simple postures to help to keep your arms, your nodes healthy. Okay, over to doctor.
Yeah, one important thing I want to add to what Swati taught all of you now is to do all these postures mindfully. So you have to visualize that when you're doing these postures, that the lymphatic fluid is draining nicely. You are helping these exercises are really helping you reduce the lymphedema, bring back strength to your arms. So mindfully doing this makes a lot of difference, especially when you're keeping it against the wall to a count of 15. You should not let your mind wander. You should actually visualize the fluid flowing back towards the heart and the swelling reducing in size. So research has proved that these kind of mindful practices have immense benefit and it will help you. So now we come to, yes, yeah. Dr. Sharda just wants to share her experience.
Hi friends, I was operated in 2017 January. After that, I was undergoing the treatment. After about a year, I started yoga. So what happened was, after doing a few exercises for a few days, I started doing Surya Namaskara. And that's how I landed up with this lymphedema. So it was about, after a year I started, but I didn't do it under the guidance of a yoga therapist. So that was the biggest mistake I did. I started Surya Namaskara on my own. So I got this lymphedema. So I request all of you, if you want to do yoga, please do it under the guidance of a yoga therapist. And under their guidance, I have, after I came to Prameya and started doing, now it is soft. Though it appears swollen, but it is quite soft. So I have maintained the consistency of the hand. It has remained soft. It has not become hard as such. Thank you.
Thank you, Sharda. Thank you, Sharda, for sharing that experience of yours. Yeah. So now, like Sharda said, you have to consult somebody who is well-versed in what kind of exercises you need to do once you had breast cancer surgery. So there are some, these are common things. Your doctor must have already spoken to you about it. You may be aware of it. What you should not do on the affected side is, don't allow, when you go for lab tests, blood tests, don't give that hand for blood draw. Don't get frequent blood pressure recordings on that side. Although we say use the blood pressure cuff to bring down the swelling, but again, that's done by therapists who have experience. So when you're checking regularly blood pressure at home, try not to use the affected arm. Don't wear tight clothing anytime. During the night, at night when you're going to bed, please remove all undergarments and any tight elastic night dresses with tight elastic and so on. Don't carry heavy bags. So once we forget, that we've been operated on that side, you're back to normal. You tend to go out shopping, carry bag with a lot of vegetables, fruits, or anything heavy on that side. Try to get into the habit of using backpacks so that the weight is evenly distributed on your bag. And like we told you earlier, take care of any cuts, injuries, burns, needle pricks, insect bites immediately. Please don't use hot water bags or ice packs on the affected side. I have seen as a surgeon very bad skin injuries, burns, because what happens is the sensation is slightly less. I told you earlier, we've cut a lot of nerves and tissues during surgery. So it may not be 100%. You may not feel it at all. But from a temperature point of view, it can affect you badly if you use a lot of, if you use very hot water bags. Then don't do very vigorous movements like, pushing furniture or wringing heavy bed sheets and so on. So try to avoid repetitive, vigorous movements on the affected side. So what should you do? Skincare, like I told you, very important. Whether you have lymphedema or not, please take care of your skin properly. Nail care, keep your nails well manicured. You can do it at home. Avoid, hang nails and paronychia, we call it in scientific terms, but what is it called? The Nagasuttu, which you call the Ugur Suttu in Kannada. So that you should avoid. And of course, exercise regularly to improve drainage. Do it mindfully. Maintain your body weight. Very, very important. Because as you put on weight, the risk of lymphedema increases. And whenever you feel slight discomfort, heaviness, which is not the normal thing which you had experienced, if you have any redness, swelling, if you have fever, immediately seek medical attention so that you can prevent it from becoming worse. So to conclude, remember that every patient is different. Just because your friend had lymphedema doesn't mean that you will get, or vice versa. Or somebody had more complications, it doesn't mean that you'll get. Each body is different. You know your body best. You have to remember that it is a lifetime risk. So please pay attention to all those points we spoke about today and take care of yourself. You know what works best for you, how much of exercise you can do, what kind of massage you can do. Everything you can tweak to your convenience, so that most important is regularity, consistency. You can't say I did it for 1 week, then I forgot, I was busy. All those excuses won't work here. You'll have to develop some routine. Teachers are a little bit of discipline, whatever it is. So try to do it with regularity and be aware and keep a watch for any redness, skin infections, etc. so that you pay immediate attention and seek medical help. And whenever you start an exercise program, please speak to your doctor and then only start. So any good lymphedema program has these following components. One is you have to be assessed thoroughly, because this massage and all that which we spoke to you about, if you have some heart problem, if you have some lung problem, all of that, then you should not do vigorous massage and things like that. So you must consult your doctor before you start all of that. And you have to lymphedema is what your system is like with respect to lymphedema. You have to learn the proper techniques, learn how to do the exercise and yoga. And most importantly, you have to wear the compression sleeves whenever you're doing the exercise. So I think we've managed to cover everything. Thank you very much for patiently listening to us. Now, if you have any questions, we'll be happy to answer those.
Yes, ma'am. I can see a couple of questions on the chat corner. So can we take them up, please?
Yeah. Yeah, somebody, Pushpa, has asked, we sweat when we do this exercise. So that's fine. You keep a towel handy, wipe yourself, continue to do. And importantly, please hydrate yourself. Keep a bottle of water handy. Keep a small napkin. It could be damp napkin. It may not be super dry. You can wipe yourself and continue, the exercise.
So it is okay to sweat. Yeah.
Yes, it's absolutely okay to sweat. It's a feel-good factor.
Okay. So Jalaja has a question.
Yeah, I have a dental issue, need to consult dentist. Can I consult? Will that have any issues with lymphedema? Yeah, all dental issues during treatment have to be done very, very, very carefully, and you have to discuss it with your treating oncologist. Because especially if you're on chemotherapy, we recommend that you actually finish off all your dental work before you start chemotherapy. During chemotherapy, soon after chemotherapy, we recommend that you don't undergo any dental procedures. If you have finished all your treatment and you're in the post-treatment phase, then it's fine. You can go to the dentist. That has no impact on lymphedema. You may have a few neck nodes, but that's okay. As long as you're doing the other massages and the exercises regularly, it has no impact on lymphedema. Pushpa says, I hope I answered that question. Yeah. Pushpa says, I had mastectomy with chemo and radiation. Why radiation? Okay. That's not in the scope of this program. But anyway, why radiation is depending on what was your pathology report, what your oncologist discussed with you. If you didn't, if you've had a mastectomy, usually we don't give radiation unless you had lymph nodes which were positive in the armpit, or the tumor was very close to the pectoral muscles beneath. So in those cases, or it was a very large tumor. Depending on all those issues, we decide on whether the patient needs radiation or not. Somebody, Galaxy J5, I don't know who that is, wants to ask a question. Yeah, Pushpa. So you had 4 lower lymph nodes that were affected, and that's why they decided to give you radiation.
Sangeeta has a question.
Yeah.
If it is 4th stage lymphedema, in spite of mechanical removal, is there any comfortable method to maintain and prevent further swelling?
Yeah. So when you say mechanical removal, have you had surgery, Sangeeta?
You can unmute Sangeeta and speak.
Yeah, so important, even if you had surgery for lymphedema, you have to wear a compression sleeve all the time. There is no way that you can do away with a compression sleeve, especially if you've had stage 4 lymphedema. Other than that, you'll have to do these exercises, the yoga exercises, the yoga asanas, the exercises, skincare, all of that will continue. So what surgery has done is it has just helped to reduce this swelling and probably create an alternate channel. I don't know what kind of surgery you've had, but some of the surgical procedures help to do that.
Am I audible?
Yeah.
Yeah, please.
Is it Sangeeta? Yes, please.
Yeah, please.
Total mastectomy.
We can't hear you well.
It is total mastectomy with the removal of first and second level of lymph node.
Okay.
And I have a lymphedema of whole arm.
Okay. When was the surgery done?
Surgery done at Pune 5 years back.
Okay, okay. Yeah, so what you have to do is, how is your arm very hard?
Yeah, it is hard to touch. And have a swelling.
Okay, then you will have to,
up to
yeah, you will have to start, correct. You will have to start with the exercises. You will have to start with, the massage, and you have to wear a compression sleeve. Or are you already wearing the compression sleeve? We can't hear you, Sangeeta.
because of
I think you have to you're wearing the sleeve?
संगीता, we are not able to hear you. आप थोड़ा सा आगे आकर बात कर सकती हैं स्पीकर के पास?
Because of wearing the sleeve, it feels a little bit tight and uncomfortable. So I have to remove it frequently. Can you hear me?
Yes, yes, now I can hear you. So usually the people who provide the lymphedema sleeves will take your measurement, and they will come home, take your measurement, and then they will keep adjusting it so that it is comfortable. So you must understand that it should be slightly tight. It cannot be too comfortable and loose. It has to be slightly tight. Only then it will work. All right. So important that you start doing the massage, the techniques that we've taught you, and also do the exercises and the asanas. That is very important. So you'll have to take a baseline measurement. Then after 3 weeks of doing all this, we have to see if it is showing signs of coming down. So gradually increase the pressure.
Yeah, Galaxy J5.
Yeah. Okay, but Sangeeta, probably
Yes.
we can talk to her after the session because
Yes.
her audio is totally okay. Yeah, yeah, we'll talk to you. Someone else has asked. Yes, Ranjana has asked. I'm a little confused about the oil massage at home. Any particular technique? So the oil massage, like we said, you don't have lymphedema right now. So you can just do a general massage which goes up to your heart, that is towards the heart. It should not come towards the fingers. The massage should always be in an upward direction and very gentle strokes. So that's all you have to do. There is no big technique to that. Then Brinda Lakshmi wants to know if there are any procedures to check the stage of lymphedema. So usually we go with simple clinic staging is by going with the measurement in different parts of it. It will be done at the clinic. Also by looking at the hardening of the tissues. Of course, there are other scintigraphy, that is like X-ray. There is a lot of tests which look at the pressure and the lymphatic flow, but those are a little complicated tests to be done only in certain clinics. But simple test you yourself can judge is by taking measurements at specific points. We'll be sharing a lymphedema brochure with all of you, which you can do. And Pushpa says, do lungs get affected due to radiation on the right side? Yeah, radiation side effects, long-term side effects, the lungs and the heart can get affected. But not all of them will experience it. So it's not really a matter of concern unless you have some underlying lung problem. Lalita Nambiar.
Yes.
Okay, thank you. Thank you for that comment, Lalita. Okay, Ranjana, that has lymphedema. Okay, then we have to tell you that you have to do the lymphatic massage in a very specific way, which Sneha explained, without using any oil. The moisturizer you can use after a bath, but the massage that you do should not have any oil. It should just be on dry skin and a very light touch. Jayamani, we are based in Bangalore. We will share a lymphedema management brochure with all of you. And those of you who need more information on how to do the massage, etc., can get in touch with us directly, where we will explain the whole process to you nicely.
Yeah. I think we have covered all the questions with that, ma'am.
Yeah.
People who have queries about yoga classes and how to procure an arm sleeves, kindly contact Prameya. One of us can also.
Please, Kripa, let them also tell us where they are located, because
Yeah.
for the arm sleeve, we can put them in touch with the group which is locally there, who
Yeah.
can help supply it to them.
Sir, I have their names, so we can probably connect to them after the session and get a clear picture on where they are based, and we can help them further.
Okay, and I think we have everybody's email IDs so that we can share the brochures with them.
Doctor, can I ask?
Yes,
Yeah.
Malti.
Can you please identify yourself?
This is
Malti. Yeah, Malti, tell us.
Yeah, I just want to know, when we do all these exercises, are we supposed to wear those bras?
The mastectomy bra, not necessary. Mastectomy bra is not necessary when you're doing the exercise, only the arm sleeve if you're already wearing it.
Okay, doctor. And during when we go to sleep, are we supposed to wear it? No.
When you go to sleep, you should not wear the mastectomy bra or the arm sleeve.
Okay, thank you, doctor. Thank you so much.
Okay.
Can the Galaxy J5 identify yourself? Can you please? Yeah, and you also had a question. Hello.
Now?
Yeah,
Hello?
we can hear you. Yeah, can you please
Yeah,
identify yourself?
just a minute, just a minute. Am I audible now?
Yeah,
Yes.
you're audible now.
Yeah, sorry for the delay. Yeah, see, like in 2019, I was detected with breast cancer, and a total mastectomy was being done, was being performed on me. So now I'm a AAA negative case. So now I'm going to undergo another preventive mastectomy on the other side, and they're going to remove my ovaries in the next week. The surgery is due in the next week. So, like, will I, after this preventive mastectomy, will I again develop a lymphedema on the other side?
So you're only having a mastectomy. They're not going to remove the axillary nodes. So usually the
Okay.
preventive or prophylactic mastectomy is only with respect to the breast. So
Okay.
very minimal chance, maybe less than 1% or less than 0.5% chance. Usually that will not affect the lymphatics of the arm. So the chance of lymphedema on that side is negligent, almost.
Okay.
What is your
And
name? I didn't get your name.
My name is Prakriti, doctor.
Prakriti. Okay, fine.
Yeah, and when they remove the ovaries, will I have any? You mentioned in the beginning of the session that we might have the swellings in the leg and all that.
No. It is not for that kind of surgery. I was talking
Okay.
about people who have cancer of the ovaries, endometrium, lymph nodes in that area. So you are not at risk of any lower limb edema at all.
Okay. Thank you, doctor. Thank you.
Okay.
Thank you, Prakriti. I think Dr. Sandhya answered your question.
Yes.
Hospital is Dr. Sneha in. Dr. Sneha is with us in Prameya. You can contact her directly here. And why is it necessary to have a second mastectomy? In people who are who have tested BRCA1 and 2 positive, or who are very high risk for cancer because of familial history, etc. Sometimes we recommend a prophylactic mastectomy. It is so that the cancer doesn't occur in that breast. It's rare. It's, you remember the story of Angelina Jolie, right? She had a double mastectomy and things like that because she belonged to a particular race, Ashkenazi Jews, those who have a very strong family history of cancer, those who already had cancer in one side with additional risk factors. Those people sometimes choose to have a second mastectomy. Okay.
So with that, I think we can wind up.
Yeah. Thank you.
I would also like to thank Manjula and Dr. Sharada, who participated so enthusiastically in our program and helped us in the demonstration. And thanks everyone for logging in. Any queries about yoga classes how to procure arm sleeves, we can help you with that. Since we are running out of time now, we will reach out to you via a phone call from Prameya Health. And also, yeah, with that, I think we come to the end of the program. We all hope that you've had a very useful session. Thanks to the panelists who made this possible. Thank you so much.
Thank you, Kripa. Thanks everyone. Bye.